Phoebe is our national clinical services manager. She's an experienced clinical psychologist and mental health leader with a really strong background in workplace mental health, clinical service delivery, and organisational wellbeing. Her career has spanned private practice, public health services, FIFO clinical work, and she's really accustomed to being able to support diverse teams in high pressure environments.
I am really excited to kind of jump into some of the trends that we've seen over the last calendar year and really speak to some of the stories and how we interpret them as an organisation.
So what I have just shared on my screen is exactly what you, as a partner of Acacia, would have access to.
What I think this data really speaks to, though, is that interplay that we have between our personal lives and our work lives. And when we are impacted in one, how that can travel home with us or how that can travel into work with us as well.
There are some organisations that are absolutely going to be in a place where their people are subjected to traumatic events.
We think about the content or the nature of some of these events or experiences people may be having within the workplace. What we know is that they can have a cumulative effect, and some people really like that work style, but others may not. Or is it that there's not enough guidance and that people are feeling unsure or kind of not 100% supported in their role in terms of how do I learn this or how do I develop further in this space.
Typically at this point, we're now talking the more expensive, time-consuming cases where work cover may even be involved. And I wanted to flag that because not only have we seen a reduction from the top psychosocial hazard to the third in terms of job demands, but we've also seen that a lot more people are reaching out with excessive workload versus a marked decline in excessive stress and burnout and exhaustion.
You know, we have our manager support hotline where leaders can ring through and actually get advice. I've got someone who I'm concerned about in my team. How can I support them? What would you recommend? What are some options here?
It's that early help-seeking behaviour. But to summarise what Phoebe's just spoken, yes, at the individual level we can help, but what are we doing from an organisational, cultural, structural level to be able to support as well? And I think both of those need to go hand in hand.